in a row, we've actually had some reduction in the total case count week on week. So 400. I can hear a bit of background noise. If everybody could just check their line and make sure you're muted, please, that would be great. I hear an echo. Please mute your line. So Leslie or Kathy, if you could please address this, that would be helpful. Thank you.
Yes, sir. Someone's got their Facebook open and running. I'm going to have to ask you to please stop it or put yourself totally on mute.
Okay. Nope, we're not quite corrected there.
Could everyone please put their phones on mute and turn off any Facebook?
Okay. I think we've got that fixed. All right, I'll start over. So we have a total of 5,207 cases, up 395 since January the 19th, when I last get my weekly report. And so for the past 2 weeks, we've actually had some reduction in the week-on-week case count, with 440 cases reported for the week of January the 17th to the 23rd, and the previous week was 448. Very sadly, we've had a very large increase in the number of deaths that have occurred over the last week. So we presently have 131 deaths, up from 91 deaths when I reported a week ago. So 40 deaths that have occurred over the past week. I would like to express my condolences for family members for your loss. If I look at all of the deaths that we've had to date, 105 of the 131, or about 80%, are related to outbreaks. And of these 105, 42% are associated with the Roberta Place outbreak. So that one outbreak alone has had a major impact locally on the total mortality figure that we've had. Clearly tragic. So over the past week, the week that began with January the 17th, we've had a total of 37 deaths in that week period. This is 4 times higher than the previous week in which we had 10 deaths. Of these 37 deaths, 33 of them were associated with Roberta Place. 2 occurred at RVH in their outbreak. 1 occurred at the Villa Retirement Home as part of their outbreak, and 1 occurred at the OOJ outbreak. If we look at the 33 deaths, if we look at the 33 deaths that occurred for January the 17th, 44 of the 33, or 73%, were people above the age of 80. So if we look at Roberta Place and we look at the people that have passed away, of the total 33, you've got, as I said, 24 of them that are above the age of 80 or plus. So far this week, beginning on through the weekend, Saturday, Sunday and through till yesterday, we've had 61 cases, and in the last 24 hours, we've had 29 cases. 24 are sporadic, and 15 are males and 14 are females. The ages range from under 10 to in the 90s. 26 live in Simcoe County, and 3 we don't yet know at this point where they live. 5 are community acquired, 4 were acquired from close contact, 5 were from institutions, and 15 are under investigation. 24 are presently in self-isolation, 4 are isolating within long-term care facilities, and 1 is unknown. We have a total of 1,219 of our cases being active cases, which is actually down slightly from the previous week at 1,349. 35 of our cases are in hospital at this time. This is down from 37 a week ago. The ages range from in their 30s to their 90s, and all are from Simcoe County. 4 of them are in the intensive care unit, and they're located in a range of locations, both in hospitals, both in and out of Simcoe, Muskoka. The largest number being 19 of them at RVH, 2 of which are in the intensive care unit. So these are individuals who live here who are hospitalized, and that's a different thing from how many people are being provided care here, regardless of where they live. How many are in hospitals here in Simcoe, Muskoka? So at this point in time, we have a total of 35 individuals in Simcoe, Muskoka who are 35 people are being provided care in hospitals in Simcoe, Muskoka. And of those 35, 25 of them are people who are from Simcoe, Muskoka. So the others are individuals who reside in other locations. Currently, we have 20 outbreaks, which is unchanged from what I reported a week ago. 7 in long-term care facilities, 2 in retirement homes, 2 in hospitals, 3 in congregate settings, 5 in workplaces, 1 in a community setting, and none in schools. So in institutions, which would be hospitals, retirement homes, and long-term care facilities, we have 11 outbreaks, down from 12 a week ago. New ones are the Pines long-term care facility, Kingsmere retirement home, Waypoint Center for Mental Health Geriatric Unit, and Muskoka Shores long-term care facility in Gravenhurst. Declared over the Waterford, the Pont. Actually, some of these, I must admit, aren't quite adding up. So one of them that's over is in the Waterford, and another's in Georgia Manor. In terms of our congregate settings, we have 2 group homes in Simcoe County and 1 treatment center in Simcoe County, and declared over a group home in Simcoe County. And for workplaces, 5 locations that are an outbreak, which is up from 4. So 2 are manufacturing locations in Simcoe County. Actually, 1 manufacturing location in Simcoe County and 1 professional services facility in Simcoe County. And there's an outbreak declared over, which was retail, located in Simcoe County. And we have a community setting outbreak, developmental services in Simcoe County, that remains as an outbreak. So if we look at the trajectory, how things have been going, the direction of things, it's definitely been overall improving. Certainly much worse for mortality, certainly much worse with regards to the very much emerging issue of the UK variant, or variants of concern, which I will talk about later. But in terms of overall case count at this time, on a per capita basis, improving. So 74 cases per 100,000 population, which is down from last week at 75.4. The province's rate also being down. It was 147 cases per 100,000 population per week 2 weeks ago, and then last week it was down to 110. Our average daily growth rate is 1.3%, which is down from 1.4 a week ago. And our reproductive number is at 0.9, which is down from last week at 1. So anything less than 1 means that it's shrinking and starting to come under control, the pandemic, heading in the right direction. And same for the province as a whole. The province is also at 0.9 with its numbers down. It would appear that the control measures put in place, the stay-at-home order, has been having a beneficial effect. The doubling time has increased, so the time it takes before we end up with twice the cases we have now has increased, which is a good thing. You want it to be longer. So it's now 58.7 days. If it were to keep at that rate, then we would expect to see over 10,000 cases by March the 23rd. Very much we want to work towards not being at the same rate of growth and in fact shrinking over time. We've also had some improvement in our ability to follow cases here in Simcoe, Muskoka at the health unit. That's something we've been greatly challenged with a very large number of cases. And so last week we actually were able to get to 84% of all new cases within 24 hours. Our goal is to do better than 90%, but we were sitting much worse than that in the past. That was last week. Now, with the outbreak at Roberta Place and now the identification of it being due to the UK variant, we've had to focus a lot of attention on case and contact management of the secondary cases associated with that outbreak in order to slow down the spread of this new variant into our community. And so that's having a negative impact on our ability to follow other cases. And that'll show up in our data next week when I report. In terms of immunizations, as I said, we've been doing very well with that. We, for a time, were the second leading vaccination clinic in the province. Until we started being able to deploy vaccine out to the long-term care facilities and retirement homes where we definitely needed to go. We're above 15,000 doses in total, up over 2,000 doses administered over the last week. We've vaccinated just under 5,000 residents in long-term care facilities in total. Just about 500 additional residents in the past week. The retirement homes, this is with regards to staff, I beg your pardon, the staff and the essential caregivers in these locations, giving them their first dose. So just under 5,000 people in that category have received their first dose. Remember, this is a 2-dose vaccine, and so we have some 9,600 individuals who received their second dose as well and are now fully immunized, fully protected. Noting that this vaccine with 2 doses gives about 95% protection, which is very high by any standard for immunizations. We've also immunized a total of 5,200 hospital workers and also the residents of alternate level care. So some hospitals will have patients who are ready to be discharged to long-term care, awaiting that opportunity. So they too have received immunization, their first dose. So that's actually up by a small amount compared with last week because of the slowdown in provision of Pfizer vaccine. So the province has had to greatly slow down how much vaccine it gives because the federal government has had to do that because Pfizer has had to reconfigure their manufacturing process so that they can manufacture on a much larger scale. So there is a slowdown right now that's going to continue through to mid-February before we can really ramp up immunization again. We certainly are committed to immunizing those that are most vulnerable at this time, getting them their first dose. So we've, as a week ago, immunized all the residents of all the long-term care facilities, and now by the end of the week, we will have immunized all the residents of the retirement homes that are deemed to be high risk by their design, by their nature, by criteria that the province applies. And we're also making sure that we immunize the residents of all of the retirement homes in Barrie and in Bradford, West Gwillimbury, given the Roberta Place outbreak of the UK variant, and also because of our concern about the potential for that at Bradford Valley Care Community. Okay. Now, reporting on some details with regards to the outbreaks that we have, and I worked through the facilities in order of the date of declaration, starting with the earliest and moving forward from there. So, Trillium Manor Long-Term Care Facility in Orillia was declared on December the 14th, and they have a total of 25 staff, up from 24 a week ago, and 13 residents, up from 10 a week ago. Testing taking place on a regular basis in that facility, and 93% of the residents at that facility have been immunized. Lakeside Retirement Residence in Innisfil, outbreak declared on December the 26th, which is unchanged with 2 staff cases. And Grove Park Long-Term Care Facility in Barrie, declared as an outbreak on January the 4th. They have 3 staff cases, up from 2 a week ago. Testing has taken place of the residents and the staff at the facility, and 93% of the residents have been immunized. Roberta Place Long-Term Care Facility in Barrie, and so I've certainly acknowledged just how severe their outbreak is, how tragic the outcome has been with such a large number of deaths to date, and all but 2 of the residents having been found to be cases, having been infected with this virus. So we have 27 residents, so all but 2 of the residents that are cases, and I've reported on this 4 times. Myself and my colleague, Dr. Colin Lee, have had press conferences on this outbreak 4 times in the past week. But if we go back to my last general press conference a week ago, at that point we had 65 positive cases among residents. So gone from 65 up to 127 over the course of the week. And we have 82 of the staff that are cases, so 56% of the staff have been identified as cases, up from 56 a week ago. We have 3 individuals who are external partners who've been identified as cases. We've had 3 essential caregivers who are cases, so that's up by 1 from when I reported a week ago, and for that matter, when I reported on the weekend. And as I'd indicated before, one of those individuals has passed away, has died. We have assistance being provided by the Red Cross on site, by Hospice Simcoe, by RVH, and by Orillia Soldiers Memorial Hospital. And one of the forms of assistance provided by Soldiers Memorial Hospital has been rapid testing, the capacity with the rapid test, and so that's been very helpful for follow-up. And I've also reported before that yesterday, or actually 2 days ago, that 42 household contacts of individuals associated with this response have been identified as cases. I don't have the most current figure on that, but we will provide that figure to you today. That's clearly a point of concern. The issue here, one of the issues here, is the potential for transmission in the community, and we are doing all that we can to do aggressive case and contact management and follow up with all the identified cases and their contacts to and put them into isolation and slow the spread of this new variant, the UK variant, into our community. But we do have cause for concern, I would say, One of the things I will identify for you is that we have received data from the point prevalence study that Public Health Ontario has been doing since Wednesday of last week. So on Wednesday, they obtained all the samples for all of the individuals in the province who had tested positive on that day, some 2,500 samples, and are testing them all to see if they have evidence of one of the variants of concern. And when they identify any that are positive for that, they genetically sequence the sample in order to determine which variant of concern, whether it's the UK variant or one of the others, the South African variant or the Brazilian variant. And with those results, they provide that data to the health units that are affected by this. So we've received quite a number of test results related to that are positive for a variant of concern, awaiting further testing to determine which variant. All but 2 of those have been linked to either of the 2 locations of concern that we have right now, Roberta Place or the connection that we have right now that we're investigating with the Bradford Valley Care Community outbreak. So all of them are connected with those, all but 2. We have 2 that are not. One of those 2 is an individual that is part of a very small outbreak at Waypoint Hospital. So that's important. That means essentially we have another outbreak that we're considered to be an outbreak due to a variant of concern for COVID-19, and we're awaiting further testing to see if it is the UK variant in that case. So that's new information. We have a new location now that is potentially associated with the UK variant. We just have to wait for that additional test result. And in all of these situations, we extend out further testing to get more data about confirmation about which variant and how many are affected by it. We have another, as I said, all but 2 of the original batch that came back from that point prevalence study by Public Health Ontario. All but 2 were already connected with what we're investigating. And then we have the Waypoint, and now we have another individual who's unconnected, doesn't appear to be associated with any particular outbreak, and that individual too is being investigated. This does speak to the potential for this to be transmitting now in the community. And it's really, really important that people take that to heart and behave accordingly in order to reduce your risk of being part of transmission from this new variant. And if it isn't spreading readily in our community now, it may very well do so in the near future. Another outbreak, Royal Victoria Regional Health Centre, outbreak declared on January the 9th. Their total case count is now 42, up from 28. So 19 of those are patients, up from 10, and 23 are staff, up from 19 a week ago. And they've had 5 deaths to date, up from 3 a week ago. And they are continuing with aggressive case and contact management, testing, surveillance, and immunization has been made available to the staff and essential caregivers. 55% of them have received it to date, and others would be able to have access to it. Bradford Valley Care Community in Bradford. So outbreak declared on January the 14th, but now we have this issue of concern with regards to contact, a high-risk contact of an individual found on testing to be positive for the UK variant, and an individual who is part of that outbreak. And we now have laboratory confirmation that that individual has a variant of concern, and we are awaiting the further testing to determine if it is the UK variant. So that's further cause for concern for us about that outbreak, possibly the entirety of the outbreak being a variant of concern, or the UK variant being one of the variants of concern. So we await further test results to clarify that situation. So testing is taking place throughout the facility, staff and residents, and 96% of the residents have received their first immunization. IOF, long-term care facility in Barrie, outbreak declared on January the 15th. Total of 2 staff have been identified as cases so far, and 90% of the residents have received immunization. Testing taking place throughout the facility. The Pines, long-term care facility in Bracebridge, outbreak declared January the 20th, with 1 staff member as a case, and 95% of the residents have received immunization. Kingsmere Retirement Home in Alliston, outbreak declared on January the 20th, 3 staff cases, and testing taking place throughout the facility. Waypoint Center for Mental Health, I've already spoken to this, indicating now that one of the 2 individuals as part of this outbreak have been found to have a variant of concern, and we're awaiting further tests to see if it is the UK variant. And we're managing that site now on the assumption that they've got a new variant outbreak, and therefore we have augmented control measures that we're pursuing. Muskoka Shores Long-Term Care Facility in Gravenhurst, outbreak declared on January the 22nd. 1 positive staff member, and 85% of the residents have received immunization. In terms of our congregate settings, we have 3 that are in outbreak, which is up from 2 a week ago. So a group home in Simcoe County with 16, it declared on December the 20th with 16 cases, which is unchanged. 10 being staff, 1 being a temporary agency staff member, and 5 being residents. A group home in Simcoe County, outbreak declared on January the 22nd with 1 staff member who's positive. A treatment center in Simcoe County, outbreak declared on January the 20th with 1 staff member as a case, others having tested negative. We have 1 outbreak in a community setting, which is unchanged. Developmental Services, Simcoe County, declared on January the 15th, with 5 positive participant cases up from, 7 positive participant cases up from 5 a week ago, and 13 positive staff cases up from 10 a week ago. And that facility is actually voluntarily closed for the time being. We have 5 workplaces, which is unchanged as outbreaks. Emergency Services Simcoe County, outbreak declared on January the 7th with 9 positive cases among staff, unchanged. A food processing location in Simcoe County, declared on January the 11th. 16 positive staff, up from 13 a week ago. We have we have a transport and warehouse location, Simcoe County, outbreak declared on January the 17th. 11 positive staff cases, unchanged from a week ago. A manufacturing location in Simcoe County, declared on January 22nd, with 8 positive staff members. We have professional, scientific, and technical services location, Simcoe County, declared on January 25th, with 3 positive staff cases. So at this point, I will turn to some media points. Clearly, the new strain, the UK variant of COVID-19, is of great concern to us here. This is a variant that is known to be more transmissible. It's 50 to 70% more transmissible, and with that, it's easier to catch. And we certainly saw how rapidly it was able to progress through Roberta Place and affect almost all of the residents at the facility and half of the staff at that facility, and now a large number of secondary cases in the households of people that were part of the response. So we continue that investigation. I'm very concerned about the potential for this to transmit into the community. And we're doing what we can as a health unit to slow that down. And I think also the key question right now is how much transmission is going on in the community. We've had a little bit of data from the point prevalence study being done by Public Health Ontario at this time, dating back to last Wednesday. And we await more data from that to get a more fulsome picture as to how common the virus, the variant was, at least on that day, on Wednesday last week, just to give a sense, a snapshot in time as to how common it is here right now. But this will be very dynamic, and it will be very hard for us to prevent this from transmitting in the community. And I think we all need to now take our precautions very seriously because of how readily it transmits, how easily it transmits. And so what's really key at this time is for us as a health unit to continue to map out where it goes and to protect our most vulnerable people, our people in long-term care and retirement homes. And so we've immunized all the residents in the long-term care facilities, and we're moving to immunize all those residents in retirement homes in Barrie and also in Bradford, West Gwillimbury, given the two locations of these outbreaks. Noting that right now we still don't have confirmation yet that we're dealing with the UK variant in the outbreak at Bradford Valley. We await that with our investigation, but we're acting in a precautionary way, protecting the residents of these facilities there. And now elsewhere throughout Simcoe County, immunizing the residents of long-term care in the high-risk homes, all to be done by Friday, so moving as quickly as we can on that. But at this time, we're in partnership with the city of Barrie about raising awareness. I've had discussion with Mayor Lehman about this. I've had discussion with Chief Greenwood about this. And we really need to raise awareness about the requirement that we all have to obey the stay-at-home order. So basically, this order says that we only leave our home for essential purposes. So shopping for food and buying medications or getting medical care or physical activity. But otherwise, or going to work for those that have essential work, right? But while schools are closed, you're not going out for school, right? So otherwise, you are to stay at home. And you're not to have people over to your home. And the only exception to this would be if you live alone, in which case you adopt one other household to be part of. Only one other household, and they only take in you. So you are not to go visit other people in their homes. You are not to have other people come visit you in your home. This means you are not to go visit your grandchildren. You are not to go visit your grandparents. You are not to go visit your other family members in their home or your friends. We are not to do this right now. This is really important right now, in particular, with this new variant on the cusp of spreading into our community. We are simply not to do those things. We have to comply with the stay-at-home order. We're going to get more messaging out with a lot of support from the city of Barrie, because that is at the center of a very large number of people right now that have this virus, and the potential for it to spread here is immediate. So we do have the support and the attention of the leadership for the city and the police as well, and we will be promoting this. And there is a potential for enforcement. This is something that is enforceable, and we're in discussions with the city and the police as well about that. So I've also spoken about immunization, just how critically important that is, and the fact that we're hampered right now with the supply of vaccine, and the timing is certainly very challenging, coupled with the UK variant being here as well. We do what we can to use the vaccine for those who need it the most with the limited supply we have. And we make the case to the province that we would benefit from having more supply right now to make sure that we can protect people better. Certainly we are preparing for the time in which we will have plentiful supply and are reaching out to our municipalities to identify locations where we would be setting up community clinics to immunize, working with our family health teams and other partners in order to set up those clinics. So that's something that I anticipate will come into full force in March. It would be much better if we could do it sooner, but the supply doesn't allow for it. But please, I would advise people to be aware of that coming. And we are identifying who would be at the priority immediately when we get more vaccine. There's certain groups, healthcare providers, paramedics, those who work in assessment centers. It would be an immediate priority when we get a better supply of vaccine. When we have more to give after we finish protecting the most vulnerable, which is those at residents in long-term care facilities and retirement homes. And also people are going to have patience with regards to their second dose. We're now following the provincial directive that we can extend out the provision of a second dose in most instances as late as 42 days. I'd like to do it earlier if we can, such as 35 days, but that really depends on supply. So there are many healthcare workers in hospitals, long-term care facilities, and retirement homes, and essential caregivers as well who would be awaiting their second dose, and it's going to be extended out because of supply. So we have the following media questions. SMDHU was to begin vaccinating residents of retirement homes here at Simcoe, Muskoka, beginning last weekend. Is there a progress report on how things went? Status of vaccine availability to continue to do the job. So a week ago, I wanted to be able to immunize the residents of all retirement homes. And at this point in time, we realize we don't have enough vaccine to do all of them. So we're doing those that are in the high-risk homes, and we're doing the residents in all of the retirement homes in Barrie and in Bradford, West Gwillimbury, given the proximity to where we've had cases of the UK variant. And we'll monitor that situation very closely. We do find we've had to adapt our decision-making frequently as circumstances have changed and respond to the information that we have at the time. So that is a change from what I said a week ago. And I have given some statistics as to how much immunization that we provided to date. Another question, can you please provide a bit more information on the individual who was in close contact with or worked at the Bradford Valley Long-Term Care Home? Your release said the person was connected to a retail outlet in Simcoe County offering pickup where 2 people tested positive for the virus. Was the person there an employee of the retail outlet, or were they picking up merchandise at the time of exposure? So in my press conference Sunday, when I reported on this, I did indicate verbally that that individual had been employed at this retail outlet. But otherwise, I'm not going to be providing more information of a detailed nature about that person, because we do need to protect the identity of individuals. We give out enough information for the public to be aware and be able to protect itself, but we otherwise protect individuals, their identity. Others who were in contact with this individual have been followed up for management and isolation and testing. And with this individual being identified as having not just COVID, but the UK variant of COVID, we are being more aggressive now in our case and contact management as we are with what's happening with the cases at Roberta Place. And finally, has the investigation been completed at Roberta Place to determine whether the individual who traveled and had contact with a staff member violated any of the provincial COVID guidelines or rules or Canada's Quarantine Act? If so, what are the results of the investigation? What I can say is that is something that we are actively investigating right now, and I don't have complete information to provide on that. One extra bit of information I would say is that we do know that that individual has tested positive for the new a variant of concern, and we're awaiting confirmation as to whether or not it's the UK variant. So at this point, I'd be happy to take questions.
Thank you, Dr. Gardner. I'll go through the list of people who have checked in, and at the end of that, I will ask anyone who has not yet registered to ask a question. We'll go 2 questions. Erica Engel calling with today.
Hello, Dr. Gardner, I spoke to you soon after the first vaccination was issued in Simcoe, Muskoka. I know it was amazing and a significant experience. How frustrating is it for you and the health unit to face this shortage and not be able to proceed with vaccination like you thought you would?
It's deeply disturbing, very disappointing, and the timing now is very bad considering that we've also got the arrival of the UK variant with large numbers at more than, well, one location in particular, but also 2 other sites. One other site for sure, and then the potential for Waypoint with its case of a variant of concern that probably will turn out to be the UK variant. So I'm very concerned that we don't have a large quantity of vaccine to be able to more broadly protect healthcare workers at this time, or those who work in assessment centers, paramedics. If we had a plentiful supply, we'd be able to move on aggressively to offer them this protection. And it's extremely frustrating and disturbing to me that we cannot do that. We've got to limit ourselves with focusing in on first doses for the retirement homes, and even there, for the most part, it's the high-risk retirement homes. And otherwise, hoping that we get more supply to be able to continue with second doses for people in those facilities to make sure they get maximum protection. So indeed, it's unfortunate.
And you said that you are now going up to 42 days between doses. Is that from the manufacturer? Like, is it still going to be just as effective as it would be at 21 days?
So the manufacturer actually recommends between 21 and 27 days. And it's been recommendations from the National Advisory Committee on Immunizations, which is the national body of my colleagues who have a high degree of expertise, look at the evidence, and actually make recommendations for the governments, provincial governments across the country on how immunization should be used, regardless of what the manufacturer says. So they've recommended it could be extended out to 42 days. The province has indicated that we can do that, though they would prefer 35 days at this time. The World Health Organization has indicated that you have that option of being able to extend it out as well. And a report from the chief medical officers of health across the country also supports moving in that direction if we have to, due to supply shortages.
Thank you.
You're welcome.
Thank you, Erica. Move on to Sean Gibson from Barrie Today.
Hi, thank you. Yesterday we all saw the ministry inspection report regarding Roberta Place, and there were a few violations on there. I've spoken to some staff who said that the violations are accurate but are misleading. One of the examples was, some of the residents were wandering around, and staff have said it's extremely hard to stop that, especially with those with dementia.
Yeah.
What was your take on all of that, on how hard it is for residents to be, for lack of a better term, locked in their rooms? They report that you saw damning to you?
I think the Roberta Place had something extraordinarily difficult to deal with just how rapidly this spread through the facility. So it was declared as an outbreak on the 8th of January, and through the weekend it was well over 40 cases among residents throughout the facility that emerged, identified through testing, some with symptoms, and it's, spreads, in the course of a 2-week period to be almost all of the residents. So it moved very fast. I think that speaks to the nature of this UK variant, that it can do that. And that made it difficult for the home to be able to set up the cohorting that is required. So the cohorting is the idea that you limit residents to a location, you match up cases together away from those that aren't cases, you match up staff to take care of only a limited number of residents and stick to those that are cases, or staff that stick to those that are not. You don't have staff moving between residents that are cases and residents that are not to help reduce transmission. That's a standard infection control practice during an outbreak. But when you've have it rapidly progressing, it's hard to be able to do that. And then when you lose staff to illness, it's hard as well, because it takes more staffing as a per facility to be able to carry that out well. So I agree that it didn't happen, that it needed to happen, but I also think that it was extraordinarily difficult to make it happen. And demented patients tend to wander a great deal, and that can be very difficult to control, even under the best of circumstances.
Sure. The follow-up, I didn't get if you have the numbers yet for if there was an increase in the deaths at Roberta Place for today's numbers, but what I was wanting to know is, with all the 2 residents testing positive, it seems like every day, and I'll care how I say this, but it seems like every day we're waiting for more bad news. At what point will we start to see the deaths stop and recovery begin, and we can start getting needles in the arms of those who need it? When's that cutoff point?
Well, we've had a very high mortality rate with this outbreak. In part, it's due to the very large number of cases. So that's one of the major issues with the UK variant. You get a lot more transmission, you get a lot more cases, therefore you have a lot more mortality. But it's still a high case fatality rate as well. A third or more than, well, here we're looking at more than a third now of the facility of the residents having died. You can see that kind of mortality rate in people above 80, but it's certainly at the high end, and it's not over yet. We have to wait and see in the end what the ultimate mortality figure will be for this facility. So one, I think, some good news is that the rate of transmission among the staff has declined greatly, and that shows that infection control practices with staff are having a benefit. But because you've got almost all of the residents as cases, we're unable to make an improvement with regards to that. When it comes to the outcome for the residents now, it's about care. How sufficiently can their care be provided? And that comes down to staffing levels. Are we able to maintain staffing levels with the professionals with the skills required in order to give them the care that they need, so that their chances of survival and recovery are maximized? And we need to do that in a way that doesn't endanger the staff. So maintaining infection control of the staff is absolutely key as well. Anyway, I'm not sure if I answered your question. I don't think you're going to see good news in this, apart from the actual outbreak coming to an end. And that really comes down to no more transmission among staff. There's also the bigger picture, which is transmission in the households of staff and out into the community. And to me, we're at the beginning of that. We've got to do all we can to slow that down, but I'm very concerned that we're at the beginning of that.
Thank you.
Okay, we'll go on to Matthew Riesler from Moose FM.
I have no specific questions to ask. Thank you.
Well, thank you. We'll go to Holly Mackenzie-Suter from Canadian Press.
Hello, I have another question about the data on the Roberta Place outbreak. Like you just mentioned, with the close contacts and everyone infected in that outbreak, that's well over 250 people as far as I can tell. So I'm wondering why not test all the swabs in that outbreak for the UK variant, just so the provincial data actually reflects the scale and how many people are in fact infected with that.
Thank you for the question. We would like to get as many tests done as Public Health Ontario would accept. And so we're proposing that. And we've had a very large number of test results come back from Public Health Ontario in their point prevalence study. So there was some 84 test results that I'd recorded in verbal communication from them yesterday. I'm not sure what the figure is today. That were positive results for the variant of concern associated with this outbreak. And so the next step is that they need to test those to see if they are the UK variant, but I'm certain that they will be. I believe that absolutely every case that's occurred in this outbreak at Roberta Place is in fact the UK variant.
Thanks, and I just had a few more technical questions, how many residents or I guess deaths in total are associated with Roberta Place, and I'm also wondering with the Waypoint Hospital outbreak if the people infected are staff or patients.
Okay, so with regards to your first question, my figure that I've got here is 46 deaths in total from Roberta Place at this point in time. And your second question was, sorry, could you repeat it, about Bradford Valley, was it, or Waypoint?
Well, if you could, Bradford Valley, I was wondering, how many infections at this point, and with Waypoint Hospital, I know there's 2 people infected, but just wondering if they are staff or patients.
So for Waypoint, 1 staff, 1 patient are cases. And I'm just looking through my notes for Bradford Valley. I did touch on it through my presentation here. But I just need to find it where it was in my notes. Okay, 8 residents and 3 staff as COVID-19 cases, one of whom has had now a test showing that they have a variant of concern. And more tests to come with regards to that individual and whether or not it is the UK variant, and more tests to come on the other cases to determine whether or not they have a variant of concern, including the UK variant.
Okay, thank you, Holly. We will go on to Dana Goldfinger from Global News.
Hi, Dr. Gardner. Thanks for doing this conference again with us today. Just wanted, before my questions, just to confirm an apology to reiterate the number of deaths today for Roberta Place. I have 46 now, is that right?
Yes.
Okay. And so my first question would be, in terms of the variant testing, how does the health unit, and I don't know if you can speak for other health units in the province as well, but how is it determined whether testing goes to the Ontario lab for any variants of concerns or the UK variant in this case?
Good question. It can happen by more than one means. So first off, as providers, those that are ordering the test, or for that matter, us as the responding health unit, if we have a case or a potential case that is associated with travel. And we're to note that in our requisition to Public Health Ontario to seek the testing for a variant of concern. Or if they have a contact with a traveler, or an outbreak that is progressing very rapidly and aggressively. So that's why we ordered the testing to be done for Roberta Place, which was done a week ago on Wednesday, and hence the results that we received back. Another way in which this can happen is through the studies that Public Health Ontario may wish to pursue. So they're doing this point prevalence study right now with all the positive test results for COVID from last Wednesday being tested for a variant of concern, and therefore for the UK variant. So that's another way in which testing can happen. Another way can be if a local lab chooses as part of their policy to do screening to identify a mutation that may suggest that you're dealing with a variant of concern. And when they find that they notify Public Health Ontario for confirmatory and follow-up testing. And that is in fact how our case in Simcoe County that is associated with an individual who's part of the outbreak at Bradford Valley was discovered.
Okay, thank you. And then a follow-up question, sort of coming from information from my colleague in Kingston, a case in which one resident there has the COVID-19 variant, UK variant. The health unit there has been that virtual caught the virus while working in the Simcoe, Muskoka area, but they're not related to the Roberta. What's your perspective on this when it comes to community spread? And I should also note that they caught it several weeks ago.
Well, clearly that speaks to the concern that I have, that in fact we may very well have community transmission happening right now with variants of concern, with the UK variant, that through the course of time it would, because it's more infectious, more communicable, transmissible, that it's going to become more prevalent. And therefore, everybody's got to be exercising the precautions that I'm talking about, and like I said before, really take to heart the stay-at-home order.
Thank you.
You're welcome.
Okay. We're going to move on to Terry Reese from CBC News.
Yes, hi, good afternoon, Dr. Gardner. Thank you so much for taking the call. There was an awful lot to unpack here around the variant. Now, looking at your news release from today, it talks about 7 confirmed cases, additional 99 individuals who had a positive first test screening. When you talk about Roberta Place, the possibility that everyone, most of those cases are the variant. Are we in a case right now where we're actually just looking at the tip of the iceberg as to what is potential here with the spread of this variant?
I think that's a good way of characterizing it. The analogy of the tip of the iceberg being what you can see versus what you can't. And we know with our experience with COVID-19 in general is that what you see is reflective of what happened maybe 1 to 2 weeks ago. And so if we're detecting things now, then there's things happening that we're not going to see for a while. And it's, I think, better and more cautious to assume there's more happening and to take our precautions accordingly, try to get ahead of it by imagining what it is now, because you can't actually see it. So if we're seeing, these unanticipated sporadic cases happening, that's cause for concern. Certainly, the fact that we have a very large number of cases associated with a single outbreak means there's potential from all of those cases for a lot of transmissions to now take place in the city of Barrie and beyond. So 2 good reasons for us to exercise precaution now and to take to heart all the control measures, the stay-at-home order, the distancing, the masking, the hand hygiene, self-monitoring, and seeking testing with symptoms. We need to take all of that to heart.
When you look at Dr. Gardner on the fact that you do have at least one case of unknown community spread, you have the other case at Waypoint, what is your greatest concern regarding this variant at this point?
I have great concern for those who are most vulnerable because of how readily it transmits and for the potential to have a great increase in the number of cases. We've seen provincial projections that suggest that we could very well have a great surge again in cases, that it'll be more difficult to control overall if this becomes more and more prevalent in the community. That'll make it difficult to control. It'll make it difficult with regards to trying to get out of our present lockdown situation or the stay-at-home order situation. It also puts at risk those that are most vulnerable, those that have pre-existing medical conditions, those who are older, elderly, certainly those in institutions. We've seen so many institutional outbreaks. The risk goes up with the prevalence in the community. Now, I'm very happy we've been able to provide some protection to those most at risk with the immunization that we're doing, but we're not finished it yet. They've had one dose. We have a limited supply, and we'll be challenged and be able to give them their second dose. So the timing is very concerning to me, the fact that this comes at the same time as a vaccine slowdown.
Thank you.
You're welcome.
Thank you. We'll go on to Janice Golden, CTV News.
Hi, yes, can you hear me, Dr. Gardner?
Yes.
Okay, so on Saturday you had a news conference and you indicated that all but 2 residents at this very long-term had COVID-19.
Mm-hmm.
And in a press release today, you indicated that 7 people had, there were 7 cases that were confirmed with the UK COVID-19 variant,
Mm-hmm.
and an additional 99 individuals
Mm-hmm.
have had a positive first screening test for a variant of concern. How many of these are in the very long-term home, and how many are there a lot of people outside of this long-term care home that have this variant of concern?
We've been able to identify either that they're on the site or they're among those that are off-site but are secondary cases in households. In all cases but the 2 that I cited earlier, and those 2 being one that is part of the outbreak at Waypoint, and the other being unlinked with anything that we can see at this time.
Okay, so you're saying that not all of these cases are at Roberta Place, they're outside Roberta Place then?
That's right. Some are outside, but we know of them because they are part of the household cases that we've identified to date.
What proportion of the cases at Roberta Place do you believe are the new variant?
All of them. I have no reason to believe it's anything other than all of them would be the UK variant.
Thank you.
You're welcome.
All right. Thank you. We will move on to Adrian Falconet from IFM.
Thank you, Leslie. Dr. Gardner, I just have one quick question. Have any of the positive cases at Kingsmere and Allison been retested for the variant of concern?
You're concerned about cases in Alliston and whether or not they've been tested? Is that your question?
At Kingsmere.
We haven't specifically pursued that as yet. We don't have we have a number of outbreaks, and at this point we haven't actually pursued further testing with any of those other outbreaks as yet. We may yet move in that direction considering the experience we've had to date, but so far we're focusing on what's immediately before us, what we know of, and where our case and contact tracing would take us. And we also expect a lot more in the way of results from Public Health Ontario's point prevalence study. We'll expect to get more results there as well, but we've yet to progress on and consider additional testing at the other long-term care facility outbreaks.
Okay, thank you.
You're welcome.
All right, we'll move on to Karen Howlett from Globe and Mail.
Thank you. I'm just confused about where the 99 comes from. Is that from Public Health Ontario's study of the cases from January 20th?
Yes, it's part of their data from their point prevalence study.
So does that mean that on January 20th, of all the people in Simcoe, Muskoka, who tested positive for COVID-19, it looks like 99 of them have a variant of concern? Is that how we interpret that?
So far, because they've not finished going through all of their data. We may get more.
So 99 out of how many? Like how many people tested positive in your region on January 20th? Like what's the sample size for your region for that day?
I'm afraid I'd have to go back and look. It's a good question. I haven't done that, so we'll go back and look. Remember, that was well into our outbreak and our outbreak investigation with Roberta Place.
Okay, and if I can just ask a follow-up, why are 90% of the test results taking more than, like, taking 48 hours to come back? Like, why are they taking so long? I've asked that question before about test results and turnaround time. And part of the answer is that we don't actually have a laboratory here that does those testings in part of the public health laboratory system, and they have to be shipped elsewhere to get it done, so we lose some time that way. Thank you.
You're welcome.
Okay. All right, we'll go to Brett Glover from Barrie 360, please.
Well, thanks very much. Good afternoon, Doctor. I'd like to circle back to the report that my colleague Sean referenced earlier. What repercussions for the operator, Jarlette Health Service, face as a result of failing to provide safe and secure environment for residents as indicated in the report?
You're asking about some form of charge or some kind of penalty? Is that what you're asking about?
I understand that a lot of people are concerned that it seems as though there are never any repercussions for those who intend to not abide by the rules. At this point, that might be the case.
At this point in time, I wouldn't want to speculate on that. We're focused very much on managing the situation and controlling the risk. And indeed, I have indicated that they were not able to do the cohorting that was needed. But I also indicated that they would have been extremely hard-pressed to be able to succeed at it. So at this point in time, we're focusing more on dealing with the emergency of the situation rather than concern about that kind of sanction against the facility.
Okay. I was in contact with the Ministry of Long-Term Care this morning to provide a statement, written notice, and compliance orders were served on the health unit responding to that report. Is the health unit assisting in that regard, or is it being done?
So any orders that are provided from the Ministry of Long-Term Care are for them to enforce. We can't enforce them, but we actually issued two orders to them, a Section 22 order, followed by a Section 29.2 order, both of which were requiring that they would abide by our dictates about infection prevention and control, and the 29.2 that they would accept all of the assistance, resources, and leadership being provided by the agencies that were coming together to do that, including leadership from Orillia Soldiers Memorial Hospital.
Thank you.
You're welcome.
Thank you, Brett. We'll go on to Alison Brownlee from Muskoka Region.
Thank you very much. Dr. Gardner, just to confirm, it sounds like there are no confirmed variant cases in Muskoka, but not all the data is back, and there's still a risk of spread from Simcoe into Muskoka and other communities.
Yes, I think you've characterized that well. Certainly, there's always been a lot of population movement to Muskoka from Simcoe and from the GTA. At this point in time, I'm hopeful that that's greatly reduced, but I know that at least some of it still happens, even though it's against recommendations from the province and probably a violation of the stay-at-home order. But that movement would put you at risk. It's the means by which you would end up with this virus migrating to your region. But we shall see with regards to the data that comes.
Thank you. And my second question is regarding social determinants of health. I cannot begin to imagine how difficult management and tracking of the pandemic is, especially with the additional challenges regarding vaccines and the variant spread. But there are other challenges created by the pandemic and the measures involved. So is the health unit still able to continue its advocacy efforts regarding social determinants of health and aid for people who are struggling right now?
It's a good question. Under normal circumstances, we're extremely active on the front of the determinants of health, the social determinants of health advocacy. Our board is a very active board for advocacy. Through the pandemic, we've sought to maintain some capacity on that, but it's been limited. So we, during the first wave into the summer, developed a mitigation strategy that pulled together some data about the other impacts on health associated with the pandemic on people's mental health and child well-being and substance use, violence, and sought to indicate ways that we could mitigate them, but it's been a challenge because we've had to put so much of our resources just into the immediate task of case and contact management and outbreak response and immunization and enforcement for the restrictions. So we're limited. We've still kept up, for example, some focus on opioids and work in advocacy on opioids. We have advocated for basic income at this time because that certainly would have been handy to people if they had had that all along, rather than seeking to get the benefits that are dependent on them making the case that they've had to be off. I've communicated before to the chief MOH about the need to open schools, particularly Muskoka, where I think the case is stronger because disease rates are so low. Because you share a school board with Halliburton, Kawartha Pine Ridge. They up in Muskoka, they share that school board, and half of that school board is going to have in-class education, the other half will not. So we do what we can, but it's limited at this time.
Thank you. It's an incredible amount of work, but thank you for your time today.
You're welcome.
All right, John McFadden from Muskoka Region.
Yes, Doctor, thank you very much for taking my call. I just want to confirm the numbers on the First Nation territories in your region. 3 cases in total on Beausoleil First Nation, 3 cases on Wata First Nation, 5 cases overall on Rama First Nation, and 0 cases on Moose Deer Point First Nation.
So thank you for the question. One of the things that I was reminded of by my staff is that we have to be very respectful of the autonomy of those communities with their health data. And so we may receive some reports from them, but it's for them to decide whether they would publicly report. And so henceforth, I need to respect that, I'm afraid.
Okay, so you're unable then to confirm those numbers. Is that essentially what you're telling me?
I'm telling you that it's not appropriate for me to do so, and it'd be more appropriate for the communities themselves to decide what they would want to communicate on such numbers.
Okay.
Yeah.
All right. Are you able to address what you would say to the folks that live on those 4 territories in terms of the vaccine arriving on their territories? Is that something you can address?
Yeah, absolutely. I would say that, like everywhere, I would encourage them to take full advantage of immunization when they have the opportunity. I would also say that we're very restricted right now in how much we have. And if we had a large supply, we would be moving very quickly to make it available to those communities broadly. And at this point in time, I'm very sorry to say that we are very low on vaccine and are having to focus it on those that are in the long-term care facilities, including such facilities in these communities. We have provided vaccine for the long-term care facility in Rama, and there is an elder home there that we are going to be proceeding and providing immunization for as well.
Very good. Is it your understanding that of the 4 First Nations territories, Rama is the only one with a long-term care facility?
That is all that I've been made aware of. If it turns out that there are more, we'd be happy to look at what we could do.
And finally, Doctor, thank you for that. Could you please address, as we know, these are tight-knit communities, and in some cases, housing is an issue where you have 2 and sometimes 3 generations living under one roof in sometimes cramped quarters. Could you address the sort of specific challenges when it comes to avoiding COVID, battling COVID on the 4 First Nations territories?
Well,
please?
Yeah, with those kind of housing arrangements, there's much greater risk of transmission throughout the entire household, and having its particularly devastating effect on those that are vulnerable, those that are older, those with medical conditions, and you can end up with tragic results. So I would readily acknowledge that that kind of housing arrangement puts people at risk. And it's also a challenging issue to address. I'm not sure offhand exactly what you do about it. And one thing we will do is if we get a situation where there's an individual that's a case and they're in a housing arrangement where they can't properly self-isolate, then we will arrange for them to have a hotel so that they're not exposing other people in the household.
And who pays for that hotel?
If we can't find anybody else, we end up paying for it.
And who else might you find?
We've asked the province before. They've made funding available for dedicated quarantine centers, and actually, I think more recently are open to the idea of paying for individual hotel rooms as a substitute for that when they don't exist, and they don't exist here.
Very good. Thank you very much, Doctor.
You're welcome.
All right, we'll go to James Bowler at Coach Co. Are you still with us, James?
I'm still with you, thank you. Dr. Gardner, I just want to expand on Alice Brownlee's question about the Muskoka potential spread. Should, I asked you this actually last year around this time, actually it was more March, but, should we be considering COVID is moving in the community? In this situation, should we be considering that this UK variant is in our community in Muskoka now?
I think it's safer to assume it is. If it isn't there now, it will could very well be there very soon. And if you assume that it is, then people are taking more seriously the control measures. And to me, I sum it up now as stay at home. It keeps it very simple. Go out for only the essential reasons and keep your distancing when you do go out, and use your mask when you do go out. But follow the stay-at-home order. You cannot go wrong if you do that, and it's required that people do that. And with this variant, they have a even more tangible reason for doing that, and people should assume it's the safer thing to do. Assume that it's in your community.
Just as my follow-up question, just wanted to ask about the Ontario numbers that have come out recently. We've seen the tests pretty much cut in half. I'm just wondering if you can give some insight into what's happening with that. Would that be considered the province, the health units aren't doing as many tests, or are not as many people looking to get tests? Because we're seeing numbers below 2,000, but that's with 30,000 tests, as opposed to more than double that just a week ago.
I have no reason. We actually plot our testing. I'm just going to scroll down and have a look at it. So the testing trajectory in Muskoka has actually been going up, and actually Muskoka, Simcoe, and the province as a whole has been on its way up per 10,000 population. So I don't think it'd be accurate to say that it's coming down. Although that might be slightly dated information, so I think I'll look into. No, it's as of the 17th. So we've got the week of the 17th. So that's only a week behind. So up to a week ago, we in fact were experiencing an upward trend in testing. So I don't think it'd be accurate to say that it's due to a sudden reduction in testing. I don't know why it would suddenly go down to explain that number. And you'd also expect the percent positivity to increase if, in fact, what you were seeing was due to a reduction in testing while the prevalence was continuing, and that too remained up the week of the 17th. I don't see why it would have changed dramatically in a week. So I think the most likely thing that's happening is we're actually seeing benefit from the control measures, from the stay-at-home order, from the lockdown, post-Christmas holiday season. Certainly during that season we saw a surge. 21% of our cases in Simcoe, Muskoka were associated with social gatherings at that time. So we're beyond that season, and I think we're probably seeing the benefits of the control measures.
Thank you.
You're welcome.
All right, we'll go to Mark Bruneman from Barrie today.
Thanks again for the opportunity. So on Friday, Dr. Tan reported that there were 31 cases of the UK variant identified in all of Canada. And things have obviously changed rapidly since. I'm wondering if you could expand upon the testing process and your request for tests for the variants. I'm guessing this is a very expensive and difficult test to do, so not all the positive cases are tested that way, but I'm hoping you can expand on that.
Okay, so the test is a two-part test. There's a test for a mutation that's associated with the variants of concern. That can happen in a day. And then once you've got that as a positive test, the next step is to do genetic sequencing in order to determine the entire genetic code for the virus that you're dealing with, and matching it up to see what variant it is, to determine if it is the UK variant, the Brazilian variant, the South African variant, or something new. The province has, as I've mentioned, done in the midst of doing a point prevalence study where they're testing all of the positive samples for COVID from last Wednesday to see how many of them are positive for the UK variant or other variants, carrying out that two-step process to get that done. Beyond that, if you want to get testing done, you have to request it, and specifically they wanted us to make that request where you had a travel history in an individual or somebody with a contact with a travel history or an outbreak that's severe and rapidly progressing. There's a potential to, if it's transmitting freely in the community, unlinked to any of that, there's a potential to miss all of that without other indicators for testing or more frequent testing happening on a significant proportion of the samples that are coming in. So the system, I believe, needs to be developed to be more robust so that there's a higher proportion of testing happening. I guess, the ideal, if resources allowed for it, and I'm sure this would take time to develop, but the ideal would be to test every sample.
Thank you. An unrelated question, and that has to do with the increase of local deaths. I understand there's a coordination with local hospitals as well as organizations to limit the pressure at for local hospitals on the morgues. Are you able to touch on that as well, what's being done locally to limit pressures that way?
So I made some inquiries about that question. It comes down to mass fatality planning, which was pursued during the first wave. So Dr. Dirk Heyer, the chief coroner for the province, had worked with hospitals and funeral homes in order to have capacity to manage a large influx of mortality of cadavers. When I inquired about what impact we're having right now in Barrie with the deaths from Roberta Place, what I understood was that process is working well, that the cadavers are being processed through the homes and being cremated, managed, so that at this point in time there's not a crisis or a backup with regards to that here.
Thanks again. Appreciate that.
You're welcome.
All right, Mark Claremont from Muskoka.
Yes, Doctor, now that it's 1 year officially since the start of COVID, and from what you have seen recently, certainly around Roberta Place there, would you support discussions? I know you don't want to put the cart before the horse when you're dealing with an emergency right now, to end the practice of private care homes and put it into the hands of public facilities.
Mm-hmm. Thank you for the question. There was an important paper that was published during the first wave, or at the end of the first wave, in the Canadian Journal, Canadian Medical Association Journal, that looked at the drivers behind mortality and outbreak size in risk of outbreak in long-term care facilities, and it found certain factors were correlated with it, and private ownership was correlated with severity, mortality, and so was the prevalence of transmission in the community. So I think it's an important question to look at. I think whenever you have an event like this, you've got to look at the potential to make that kind of change, given that it was found to be an important factor, and determine whether or not it's necessary to move the system away from that, or if there's something that can be found to mitigate that somehow. That's got to be looked at, but it is an important question to be answered.
Okay, thanks very much. And regarding the Barrie, you said in one of your press releases, I guess a week ago, there's so many of them recently, that Barrie is ground zero, certainly for UK. And as somebody alluded a few minutes ago, compared to 31 cases in Canada, and now it's, I don't know what the number is nationally. Do you think that it's time that Barrie became some kind of an island, protective island? And would you welcome, or can you unilaterally order some kind of a lockdown around your community of concern? Inward and outward migration, I guess you'd call it?
Well, I think the movement in the population is a problem, an issue anyway, across the board to begin with. And I've long advocated that there needed to be some form of restrictions when you've got a lot of transmission happening between jurisdictions. And so this would be the latest example of that. I know that such a move would be very unpopular, like the idea that the police would enforce that you would have to have an essential reason to be traveling between communities. That'd be very difficult and very unpopular, but actually was done in Australia, so it's not without precedent. I think right now what's really critical is that we have the kind of support we got from the city, and I expect from the police to raise awareness and look to enforce the restrictions that will help to reduce transmission in our community from this variant that is very numerous now associated with this outbreak at the site and affecting households that are associated with the site. We've got to act quickly to reduce the transmission in our community. And to me, it comes right back to people following the stay-at-home order, the municipality raising awareness about this and looking with the police and public health to enforce